Hi colleagues, Jenny Muir here from the National Mental Health Commission in Australia. I'm very pleased to present to you the communications response that Australia has had for the mental health impacts during COVID and over the past 18 months. This has been a coordinated and truly national response, and I thought that it would be a really informative and insightful case study from a country's perspective in response to a crisis. So I hope that you can see and understand all of the information. I'll try and keep it not as technical as sometimes we can get. So in Australia, back in late 2019, we already had significant natural disaster consequences that were already impacting the mental health and well-being of those communities that were impacting. So we had quite a number of unprecedented challenges already. Drought. We had 62 communities and towns flattened by bushfires. We had hailstorms, and we were building up to a national level of anxiety around the impacts of climate change as a consequence of all of those kind of natural disasters and the distress levels that people were in. Now, moving through to the beginning of 2020, as all of you are, and we are all still experiencing, the COVID-19 pandemic was declared globally by the WHO, and Australian government's response to that formally was in the end of February in 2020. And like many of your communities and your governments, we all needed to transfer our minds and our thinking into very, very serious public health responses that change the way that our communities experience their day-to-day lives, including the way that they worked, the way that they were learning through education, and their general ability to move around, and obviously the serious consequences of COVID-19. In context, as a country, we responded to the bushfires and the droughts, particularly the bushfires, with emergency responses and with the mental health and well-being of the affected communities very much at the heart of what we were doing. We'd already coordinated communication and public information going into those communities. What we knew from evidence was that the single biggest thing that the communities needed to remain doing was to stay physically and socially connected. So, of course, if you think about that as the core instruction that was embedded in all of our communication into those communities, and then the consequence of that, when you think about go forward into February, March of 2020, we were challenged with having to almost contradict ourselves and provide the community with alternate and I guess almost the reverse message is to stay socially connected but physically distanced from each other. The research told us that we needed to find a way to ensure that the communities affected by bushfire and natural disasters still remained socially connected because they were traumatised from these natural disaster events, and we were concerned that they were going to get further emotionally distressed by the compounding effects of COVID. Like many of your communities, some of the immediate impacts and the changes that happened across Australia that were impacted people's mental health and their well-being and distressed people greatly was the lockdowns that the governments needed to impose on our communities, where people were confined to their homes and with very, very strict sort of movement orders. So we were physically distancing, but we needed to appreciate the mental health and wellbeing impacts of that. People were panic buying, binge buying from supermarkets because they were concerned and afraid of what the consequences were for being in lockdowns. And like many communities across the world, our economic and financial health was also impacted as businesses went into lockdowns or restrained trading. Global trading and global economics slowed down considerably. What the immediate impact in Australia was, we had quite a lot of Australians lose their jobs, and that is, as we know, very distressing to people, because they're not only in a physical health pandemic, but they're also suddenly distressed from their losing their jobs and also not having the financial means to sustain themselves. Other impacts on people's emotional well-being and their mental health, anxiety and depression, was children needed to remain at home and be homeschooled. I said we had job losses, we had industry shutdown, we had to coordinate the country's health responses to COVID. And most importantly, we had an immediate fracturing because of the physical distancing of our social and emotional networks. All of those things combined, we knew were going to have a significant impact on everybody in Australia. It wasn't that we were saying those that were already challenged with mental health illnesses were just going to be the ones that were impacted. It was safe to say from the data that we had and the messaging that we subsequently developed was that every Australian, regardless of their circumstances, was going to have their mental health and wellbeing challenged. And for many, this was going to be the first time that they experienced this. And we were motivated to ensure that everybody knew how to care for themselves and care for their loved ones. So the problem was substantial. As I said, when we obviously look at public health communication strategies, you always have to be very specific about what the problem is you're responding to and how you're going to actually respond. So just to recap, we were a country that went from significant natural disasters and the trauma and impacts of that on our mental health and well-being. And then we immediately needed to switch to basically reversing some of the key information that was supporting and responding to those communities' mental health and well-being and the trauma that they're experiencing, to telling them that they needed to actually disconnect from each other. So the problem was that we needed to address that issue immediately, but we also needed to ensure that every Australian received the same information, and that the message, the very, very important high level and consistent message, was that they needed to appreciate that their mental health was equally as important as their physical health, as they needed both to be able to respond to the day-to-day challenges of COVID-19 and the measures that the government were having to put in place. And quite simply, we gathered a significant amount of evidence globally and in Australia to be able to build that case. And from a sort of a good practice perspective for health, sort of integrated communication campaigns, the evidence set the baseline for us and was always the point of reference. We also needed to do it very, very fast. And so we needed to build this communication program with a very low cost scenario, and where we needed to embed a high level of trust in the information, that the information was coming from a position of authority, but it also was able to be organically shared from within families, across communities, and across social networks, so that it could be put on people's fridges, it could be shared via text message, it could be shared across all sorts of social and digital platforms, so that we needed to keep it very low cost and low tech in what the content and the information was. The other really important thing that we decided right from the get-go which was right from the beginning in this scoping out, was that we needed to all speak the same messages. So we needed to coordinate across hundreds of organisations who represent and support people's mental health and wellbeing. We need to coordinate across governments in each jurisdiction, and we needed to also build a trusted collaboration and partnership model, so that all of the communications managers from all of those organisations were involved right from the beginning, and they were developing together all of the key messages and information and materials, and that they had a vested interest in disseminating that, and they were highly supportive of that. We couldn't have a situation where the information was then interpreted, because we couldn't run the risk of the meaning being distorted in any way. So, as I said, we had lots and lots and lots of data, and what we needed to really look at was the key things that were informing us, and we also needed to maintain a system where we were monitoring and reporting and adjusting our communications program and messaging when we needed to respond to the different experiences that Australians were having as we went from month to month in 2020. So key things that we knew were going to build in people's minds and their behaviours really quickly was an emotional fatigue from all of the change and the distress that people were in. There was going to be a significant increase in loneliness and people in isolation, because people, especially those living by themselves and in lockdowns, were going to become more detached from any social networks that they had from within their community. People were impacted financially, so with job losses and sort of constraints on their ability to run their businesses. So there was a lot of financial stress and distress, obviously a lot of emotional distress. The pandemic obviously was having an impact on people were falling ill from COVID. They were being hospitalised. People were being detached from their families and loved ones' support structures, particularly between the elderly and the families and communities that they relied on to function in their day-to-day. Also, sadly, we knew from the data that there was a lot of relationship breakdowns within marriages and within families, which also we were seeing an increase in domestic and family violence, given that people were under pressure being locked in their own houses together. So relationships that were already under strain, that was further exacerbated. And obviously then the other two areas that we were concerned about was those people that were already living with mental illness. Of course, their access to their treatment and services that they had every week or every month was going to be impacted. So we needed to get information to them about alternates so that they didn't actually get any sicker or they weren't in further distress. And then the other thing that we were getting evidence and data on was an increased use of mental health and wellbeing services as people were trying to look after themselves in the initial stages. So this is where we got to. We worked out that, as I said, sort of the scope of what we had and then we needed to move into how we were going to respond. What we knew is we needed to do it quickly. We needed to do it as a priority and coordinated with all the other public health messages and information and campaigns. And we also needed to do it with an evidence base informing the tips and the calls to action that we knew we had to develop based on evidence. We also knew that we needed to get information out free and through as many channels as possible. So what we did was we called a briefing meeting with all of the communications managers of all of the mental health and social service organisations. We had a briefing pack that had all the evidence in it. We identified that we needed 10 very easy to understand messages, and we needed that to be supported by evidence, and we needed that to be also ticked off by and approved by psychologists and psychiatrists who were, I guess, the clinical experts in this, so that they knew and we were confident that this information going out was actually going to help Australians care for their mental health. We also wanted to make sure that the information could be picked up by governments, by schools, by anybody in the community, and that it was really easy to understand. And the fundamental message within all of it was, if you are feeling challenged, seek help. And then what we also looked at was a phased approach, that we needed to mobilise the community and mobilise very trusted and high-profile spokespeople, as well as community leaders, so that we could put the information in their hands and they could also build it into all of their messaging, speeches and media activity that they had. Within a 10-day period, all of what I've just described to you was put together. What we also then did was the result of the priority messages. We decided that we were going to capitalise on the global hashtag In This Together. It also in Australia had a very poignant scenario, is because there's quite a famous Australian pop singer who had a song that everybody knew. It was quite an old song. It was sort of like a decade old, that actually had the In This Together sort of call to action as part of the chorus. So we could really easily build on the popularity of that. And the singer himself, he also sort of endorsed and participated in the rollout of the communication program. So what you can see on your screen is all of the messages, individual messages. Each one of them had a targeted audience and a call to action. As you can see, they're very, very simple. Children, adults, any age. Also, anybody with language challenges could also understand the very simple messages behind the campaign. All the materials were developed in this colour code. As you can see, they were translated and put into sets for multiple different platforms and in videos and versions for media, so they could use them. So the results of the first campaign, so as I said, built in 10 days and then rolled out nationally across every earned and owned channel. There was no paid spend behind this. And within the first month, this was the results, the reach, the individual news stories, the platforms that we used. And most importantly, one of the immediate results was that we had a 66% increase in non-face-to-face contact. The results for phase 1 in this together was a significant reach, and a lot of this reach occurred in the first sort of 10 days after the campaign launched, which we did with a national media launch with our ministers and with high-profile Australians. I think the significant outcome for from the communication messaging was that Australians started connecting with each other more, even if it was via video and other means to stay physically disconnected but also socially connected. It's important to note for everybody that the Australian government also supported in parallel to this communication campaign in recognition that Australians needed more support for their mental health and wellbeing, with about $74 million worth of expanded services and support to respond to people's needs. And this was done very quickly in March and April of when this campaign was also rolled out into the community. It's important to note that the expansion of those services also prioritised and enhanced use of telephone and video support services, so that it actually people could reach out for mental health support from their homes through to mental health professionals. The campaign went through from April, May and June. We were actively monitoring take-up of the messages and use of the messages, but we're also actively monitoring other impacts on Australians' mental health and well-being, and had a commitment to evolve or respond to the evolution of people's experience of mental health and any distress levels by sort of recalibrating the messaging, again, always referring to the evidence and working closely with mental health professionals and all of our partners and a coalition of services and organisations through their communications manager. So that was the consistent model that we used. And as you can see, phase 2, which we expanded on the hashtag from in this together to getting through this together, we had slightly different messages and tips for people that actually specifically responded to the concerns that we had around domestic violence, financial distress, and increases that we saw in people consuming alcohol as a means of coping, and also reinforcing the previous phases messages around staying connected, exercising and reaching out for help, as well as looking after sort of your neighbours and checking in with people who, particularly those that are living by themselves. The phase 2 results, so again, the campaign was stood up in 10 days. It was developed over 10 days and rolled out into the community. The phase 2 results was quite a large volume of activity, again, in the first 10 days of the implementation and rollout. But these messages, same processes, same channels, were highly received and quickly picked up. The media also were very, very supportive of these messages as they started to see evidence through stories that they were doing. One of the things that I need to also mention is that we, in phase 1 and phase 2, and you'll see when I get to it, phase 3, we profiled and always had used people's own experiences as first-person story accounts. That was really, really important and quite attractive to the news and media channels. So because they could then really land the messages from first person's experience and also from the experts. So all the experts, mental health experts and clinicians and police and social service experts, they all made themselves available to the media to really support the campaign as it was rolling out and whenever we really needed it. The third phase of the campaign really focused on prioritising people who already were prior to COVID were living with a mental illness. So they had a really practiced knowledge and day in, day out experience of how they take care of their mental health and well-being, even while being challenged by their mental illness. So this is where we actually co-designed this third phase campaign with them. We had a reference group of Australians who live for year in, year out with a mental illness, and they helped us create all of the messaging and all of the information, as well as obviously our previous reference group of clinical experts and organisations. They came up with the phrase making time themselves. And this was really to respond to the traditional period of time for summer in Australia where we go on holidays, we connect with our families and our friends around different religious festivals and celebrations. And really that was about sort of giving ourselves a break and helping people to understand, to prioritise making time for their mental health during this period, particularly as the evidence was telling us that they were fatigued, very, very fatigued, that they were struggling and they needed to take a break. The phase 3 of the campaign rolled out 2 weeks before Christmas and throughout January and February. It had multiple phases. We did a lot of first-person storytelling. We did a lot of distribution and coordination of the campaign and information with organisations in the community who could reach directly into individuals' homes and communities to get that phase 3 messaging through to them, as so that when they were coordinating their social activities or even experiencing lockdowns that the different jurisdiction governments were implementing with very little notice, so that they could respond to the spread of COVID where they had hotspots. It was really important to support the community groups and community leaders to get this information out. As you can see, the reach was quite substantial, and there's a consistency right across all 3 phases of the campaign. Like we started with the development of all these campaigns, it's important to appreciate the results, but also the outcomes against the baseline that we set back in March. So just a few of the results that we saw is that there was consistently a 40% increase in people seeking help. That was exactly what we were asking them to do if they were feeling challenged and their mental health and wellbeing was being impacted. We secured the support of all of the social media platforms and our national broadcaster, who integrated all of the tips and information into everything that they did, and also picked it up and put a lot of their corporate and organisational effort, both in content and distribution of the information, behind all 3 phases of the campaign, for no cost to the community or to the campaign. So this was a sort of like an in-kind support, but it was quite significant. The information and the tips and the key messages were also used within the Australian government's paid campaign that they put together, which is still running. That evidence and that expert information was relied upon and incorporated into the advertising scripts and the calls to action. So everything was dovetailed and consistent. And I think one of the really big results for the National Mental Health Commission, but also for the mental health sector in Australia, was that we've really built a reliable collaborative model to work with each other and to use the power of all of our resources and efforts in a really focused and unified way, which we will reap the benefits of going forward over the next couple of years. And everybody who I've spoken to out of my communications professional colleagues are really pleased. It also helped them, supported them through what was a really, really busy work period for those of us working in health communication. The impacts are always actually the thing that is the true measure, the impacts and outcomes. As you can see, again, the increase in people's help seeking support went up by 40% across the year, and that is still maintained. One of the biggest things that we are really happy with is that core message that we started with around us wanting Australians to really understand that their mental health was just as important as their physical health in order to be able to have fulfilling lives, particularly through the stresses and strains of the pandemic. That has really stuck, and we've seen people normalising mental illness and mental health, not the stigma around it, and some of the discrimination that people used to experience has reduced. But it's also laid a really strong groundwork nationally for us to keep building the communication and information going out into the community. There's not that resistance like there was before. I think that could probably be the silver lining to the horrible scenario of having a global pandemic, particularly for us in Australia. The silver lining is that there's that recognition of how important your mental health and wellbeing is. Also, the significant sort of outcome was the Australian government moved very quickly, and so did our jurisdictional governments, to put investment into new services and expanded services to respond to the need. So in all, from the Australian government's perspective, that was $1.1 billion, and that commitment to mental health reform still continues. And I think also one of the other measures that we looked at was we were very, very concerned when the distress levels were, we predicted would go up if we didn't do something, that suicide deaths and self-harm and admissions into emergency departments for mental illness were going to go up. We haven't seen that in our data, but we are monitoring it really closely. At the moment, our suicide deaths in Australia have remained on a normal level as years before. We have seen a little bit of an increase in admissions into hospital, but we've responded to that through additional services. Now we're in April 2021. There is a long, long road to come out of this pandemic globally and also in Australia. So we will not be taking our foot off the pedal, as the saying goes, and we will maintain our commitment and the level of communication going into the community, particularly as people are experiencing the impacts of fatigue and their ability to respond to any sort of crisis or change in situation within their lives is challenged still, and will remain challenging for, we expect, 12 to 18 months as we start to sort of manage our way out of the pandemic. I hope that has been a simple look through the lens of Australia and the way that we used a coordinated communication approach nationally to address a public health mental health scenario. And if there's any questions, please email me after you've seen this webinar. Thank you very much.